Common sense dictates that prerequisite for any treatment of any disease is that the patient be positively and correctly diagnosed. Diabetes type 2 can be any exception either. Insulin resistance, as explained, is the cause of diabetes type 2, and rise in blood glucose is its symptom. Therefore, treatment of type 2 diabetes must be geared primarily towards decreasing insulin resistance, meaning increasing insulin sensitivity of target cells. We have also explained in our previous presentation how to determine with tests whether a given patient is indeed affected by high insulin resistance, that is, low insulin sensitivity. These basic facts will help us to understand how patients can become free of diabetes or their diabetes remain at least well controlled. This diagram tries to explain what causes insulin resistance. When we eat junk food, meaning processed food containing refined white flour, white sugar, preservatives, chemical additives, etc., these foods are broken down in the guts to glucose that triggers insulin secretion. Excess glucose is converted to lipids, causing fatty liver. Excess fat chokes glucose channels in the cells, so glucose can't enter the cells, causing rise in blood glucose and conversion of excess glucose into fat, which leads to a vicious cycle. Considering every individual has their unique constitution, it is therefore likely that some of the treated subjects may not respond to a given set of treatment module. In that case, treatment may have to be custom designed. As common people all over the world are becoming more and more health conscious, and physicians community increasingly freeing themselves from the pressure of drug companies, the concept of holistic approach towards healthcare is gaining ground. Conventional drug-based treatment under the pressure of consumers is being forced to integrate traditional treatment, which has given rise to the formation in USA of 38-member consortium of academic health centers for integrative medicine. Pioneering movement of Dr. Andrew Weil from the University of Arizona is playing a leading role in this process of integration. Our institution, St. James School of Medicine, is working closely and affiliated to the Andrew Weil Institute of the University of Arizona. Integrative medicine has now become a movement, and its approach to treatment is far more effective and economical than what conventional medicine offers. Treatment of diabetes, therefore, should encompass not only diet, but to reinforce effect of diet should include intermittent fasting, fast and feast, basic knowledge of integrative medicine, and self-suggestion. We will discuss main features of each type of treatment in sequence. One important consideration in designing treatment is to determine the status of a given patient in relation to the 7 stages of type 2 diabetes. Now, what are those 7 stages of type 2 diabetes? Reversal. Here is a quick overview. Freedom from diabetes. Stage 1. Reversal by working on the root cause, that is insulin resistance. The causes are insulin-like growth factor IGF, formerly known as somatomedin, that inhibits growth hormone secretion through stimulation of hypothalamic somatostatin. Any factor, including acid inflammation, may cause insulin resistance. Deficiency. Vitamin D or B complex like biotin deficiency found in vegetable, eggs, and meat. Deficiency of that may cause insulin resistance. Increased frequency of eating daily. Eat 1 meal a day. White and brown sugar, refined white flour, vegetable seed oil from diet may induce insulin resistance. Regular consumption of processed food. Suffering from chronic vascular disease. Prolonged sedentary lifestyle. Accumulation of belly fat. These are factors. Here is another viewpoint from Dr. Mohan of Tamil Nadu. He is telling us accumulation of less than 1 gram of fat in pancreas may cause type 2 diabetes. Another postulation, to remove 1 gram of pancreatic fat, shed 15 kilogram, 33 pounds body fat to reverse type 2 diabetes. Here is Dr. Mohan in his own words.
Did you know type 2 diabetes is caused by less than 1 gram in the pancreas? If you just have 1 gram of fat in the pancreas, you will get diabetes. But you want to get rid of that 1 gram in 15 kilos you have to lose, and only then you can reverse diabetes.
Now let's revert back to description of various stages of diabetes as seen in the website of Freedom from Diabetes. Stage 2 has 4 phases. A. Adjusting to new measures, replacing unhealthy practices. It takes about 4 to 6 weeks. B. Juice fasting or intermittent fasting. Cleansing takes about 4 to 6 weeks. In this phase, weight loss is expected. C. Inner transformation, muscle building and positivity to cope with stress. D. Becoming independent. Patient fully understands the process and doesn't need others' help. Now comes stage 3. Ups and downs caused by individual problems. Sugar level may fluctuate due to adjustment of medication, stress, fever, etc. Stage 4. Since no one patient is the same, so every person have to be evaluated and treated separately. Reversal is accelerated by addressing by individual's problem like inflammation and infection, nutritional deficiencies, hormonal imbalances, too slim or too heavy body weight, kidney, liver, heart and nerve-related problems, lack of motivation, emotional problems, exercise limitations, etc. Now, stage 5. Biggest enemy of reversal is patient's own inertia, own habits and comfort zone, limited thought, inability to act, casual behavior, etc. Stage 6. Lonely attempt to reverse diabetes has low success rate. This understanding is important. Seek experts' advice, feed with positive energy from the group, undertake a systemic approach. Stage 7. Talk to the beneficiaries of the program. Here is the summary of the 7 stages of diabetes type 2. Measuring insulin level, that is microunit per milliliter, during glucose tolerance test is far more accurate than measuring only blood glucose level. Normal insulin level should show 60 microliter in 30 minutes after oral glucose ingestion, and thereafter should reduce to 30 microunit in 2 hours. Significant increase in insulin value indicates insulin resistance and diabetes type 2. A full-blown diabetic may show normal fasting glucose tolerance test reading, but highly elevated insulin level. This means diabetics need to secrete a bucket of insulin to maintain normal blood glucose level. A few words on remission, reversal, re-reversal. Whereas we have discussed reversal of type 2 diabetes in considerable details, there are opinions, for instance, of Dr. Mohan from Tamil Nadu, who has studied this type of illness and its remedy for quite a long time. He tells us that the terms remission and re-reversal should also be taken into consideration in dealing with the management of this disease. Why? Because clear understanding of these terms may or may not help to eradicate this sickness once and for all. A1C reading of less than 6.5 and fasting glucose less than 126 milligram per deciliter or 100 milliliter of blood for between 3 to 12 months may be classified as remission. If A1C reading is consistently less than 6, fasting glucose is less than 126 milligram per deciliter or 100 milliliter of blood, glucose tolerance test GTT gives normal result and the condition is maintained for more than 18 months, then condition may be classified as reversal. However, factors like negligence and complacence may cause resumption of symptoms even after several years. That requires medical intervention. That is to be classified as re-reversal. Dr. Mohan also warns that all patients do not necessarily respond to a given type of treatment. Some of the important factors are to be taken into consideration to ensure better results. What type of patients are likely to respond satisfactorily? If treatment is initiated within 2 years, however, patient under treatment for as long as 6 years may also respond with remission. Next, patients whose glucose level is not too much above 140 per deciliter or 100 milliliter of blood and are not under too many medications. Endocrine pancreas is not completely atrophied. Next, those with relatively less body fat deposition. Next, those with high degree of motivation and mental health. Next, males respond better. And finally, diabetes is known to be controlled by using both low carbohydrate diet, that is 26% to 44%, or 130 to 200 gram daily carbohydrate. Alternatively, very low calorie diet, less than 800 calories per day for 12 weeks. It is said that it is difficult to maintain remission over longer period. Remission is directly proportional to weight loss. More weight loss, longer the remission. Here is Dr. Mohan in his own words.
What they showed was that when they put people on a very low calorie diet, 46% of the participants went into diabetes remission, whereas in the control group only 4% went. Note that even after putting this low calorie diet on people on this low calorie diet, less than half of them were able to achieve remission. So somebody tells you that everybody with diabetes can be reversed, it is not true, because even with such severe caloric restriction, less than half the people were able to go into remission. Now, if you look at why some people went into remission and others did not in this trial, those who lost only less than 5 kilograms in weight, the remission was only about 3%. Okay. If you lost 5 to 10 kilos, about 20-30% were able to go into remission. And if you lost 15 kilos in weight, almost 86% of people had remission initially. And by the end of 2 years, that also some of them re-reversed back and it came down to 70%. That means about 30% of people, even after 15 kilos weight reduction, were not able to achieve remission.